A cortisone shot might be helpful to relieve shoulder pain, but does it make arthritis in your shoulder better or worse? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Osteoarthritis is a degenerative joint disease caused by wearing down of cartilage and bone within your joints. The cartilage is the tissue that cushions bones when you move, allowing them to glide smoothly against each other without any kind of pain or friction. When that cushion, the cartilage, becomes damaged, you get pain, you can get loss of function in the affected joint, like your shoulder. Osteoarthritis typically develops gradually over time, daily activities, things like lifting objects. But some people, it's not so much wear and tear, but they're genetically predisposed to that arthritis. The most common sites for osteoarthritis, are weight-bearing joints, the knees and the hips, but it can occur in the fingers and toes. It's estimated by the CDC, 32.5 million Americans have been diagnosed with osteoarthritis at some point during their lifetimes. Typically, it affects people over 40, and the incidence rates go way up over 40. And yes, it can affect the shoulder. Now, cortisone shots are really common treatments for arthritis of any joint, especially the shoulder. It's common for people with arthritis to get a cortisone injection actually as a first step to try to decrease pain and swelling, treating that inflammation or swelling in and around the shoulder. The cortisone shots into the shoulder are, like I said, an initial treatment because, yeah, they can make pain significantly better, although that pain relief is temporary. Cortisone, in theory, can also decrease joint stiffness, the shoulder stiffness, and improve range of motion. But cortisone shots are not a cure for arthritis, even if you do get temporary relief of pain and a temporary improvement in stiffness. But that benefit comes at a cost. Research has shown repeated injections may actually make things worse, causing more damage than they're helping. One study found that patients who received repeated injections over time actually had higher rates of disability than those who hadn't gotten any cortisone injections. These corticosteroids, the cortisone shots, actually appear to weaken cartilage and speed up arthritis. In one study of people with shoulder arthritis, people who received injections of methylprednisolone, one of the steroids, had worse outcomes after 1 year than those who didn't get any injections at all, or who were given a placebo injection instead of the steroid. In another study, this one was looking at knee osteoarthritis, people who got intra-articular injections or inside the knee injections of a steroid, triamcinolone, every 3 months over 2 years, had significantly greater progression of their damage, of their arthritis, compared to people who only got saline injections as placebo. Also, cortisone shots have been shown to weaken the rotator cuff tendons, especially with multiple injections. At best, the effects of a cortisone shot, that relief of pain, improvement of stiffness, typically is only about 3 months, maybe 6 months at best before it starts to return. If you're experiencing shoulder pain from arthritis, yes, it may give you temporary relief, maybe around 3 months or so before the symptoms come back. But again, those cortisone shots have significant drawbacks that I would argue make them less than ideal treatments. Again, cortisone shots are not a cure for arthritis. At best, they're a temporary relief. If you have shoulder pain, it's important to talk to your doctor about all your options, not just cortisone. There might be newer treatments, and there's some coming in the very near future that might be safer, might be more effective to help you overcome your pain, might help you heal your injury, might help you better return to what you love to do. I'd love to hear about your experience with your shoulder injury. Leave those in the comments below this video. Just understand I cannot offer you medical advice, but I do try to answer your question in a future video. Please subscribe to my video channel. Click the bell to be notified when I release a new video and when I start my live streams, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.